Hi everyone, thank you for joining us today. I'm 𝐂𝐿𝐳𝐲𝐿, your CARiNG Pharmacist and the host for today. And the topic for today is beating hypertension one beat at a time. So I'm sure those who are watching at home, you all must have some concerns about hypertension. That is why you all are watching, right? So some of you might have hypertension, your loved ones could have hypertension, or it's just that you're worried about getting hypertension. But no worries, we have a very interesting guest with us today. I will try to squeeze in as many questions as I can. So the guest for today, we have Dr. Wendy Chong, an internal medicine physician consultant from Columbia Asia PJ. Hi, Dr. Wendy.
Hi, Nick.
Hi, everyone.
Hi, everyone.
Okay, we will just have a very casual talk today.
Sure.
I think when my team come and tell me, oh, Dr. Wendy will be coming, the first thing I ask is, oh, is there any questions to avoid? Is there any special scripts I need to adhere to? They tell me, hey, it's Dr. Wendy, what script are you talking about? So Dr. Wendy will be having a very casual chat. So if you have any questions, please put it down at the comment below. And also, please stay tuned with us until the end of the session because we'll be having some interesting giveaway for you. Okay? So the topic for today is beating hypertension one beat at a time. And most of us, we have a general idea of what hypertension is. So maybe Dr. Wendy can just explain to us, in your professional opinion, what hypertension really is.
Hi, I'm Dr. Wendy. I'm a physician from Columbia Asia PJ. Thanks for inviting me. I'm feeling very honored to be part of the session today. Hopefully, we can raise more hypertension awareness among the public. So what is hypertension? All right, hypertension is about the pressure that exerts over the wall of the arteries, the blood vessel. And when your blood pressure is out of the normal range, this is what we call as hypertension.
Yeah. And hypertension, if we tell you hyper means hyper, right?
High,
and
yes.
Tension, everyone knows about tension.
Yes.
So talking about beating it, one beat at a time, can hypertension really be beaten?
Of course, but it's all about early prevention, all right? So if we do not control our blood pressure and continue to let our blood pressure to go sky high, it will lead to a lot of complication. And the best thing to prevent, so we should always, prevent is always better than cure. Yeah, so I think it is very important for us to learn about hypertension today. What is the normal range of the blood pressure? Who are those at risk? Hopefully, we can share all this, knowledge to your friends, your family, so that everyone can prevent hypertension and prevent complication.
We're talking about prevention,
Yeah.
right? When we're talking about prevention, of course, it's about measuring your blood pressure, going to see the doctor regularly, and get yourself checked. But every time when the patients go and see the doctor, after the device measure the reading, they all will get puzzled. What's this about? There's two numbers or even three numbers on the device. So how to decipher this number? So doctor, can you let us know what is the normal range or the average blood pressure reading?
Very good question. Simple, yes, the most important question. All right, let's look at the blood pressure today.
A very nice chat for you all to refer to.
Yes. All right. So the normal blood pressure here, of course, blood pressure, we have to see two values, okay? So you have the upper one called systole and the lower one called diastole. So let's look at this beautiful chart done by the excellent team. Normal blood pressure is the upper number is 120 to 129. All right, this is what we call as systolic blood pressure, or you can see as a SVP over your blood pressure machine. Now, the lower one is 80 to 84, which is the diastolic blood pressure, which is called as DBP. But I know everyone will be confused. Doctor, I should look at which one, a high one or a low one, then there will be, no need to be too OCD about it. You just focus on looking at the top one. Less than 130 will do. So 130 is your magic number to remember. So when you have a number over the upper number over your blood pressure machine, you need to be aware of. Okay, this is the normal blood pressure. Now, what is the optimal? Of course, optimum blood pressure is for those in good health, in excellent health, you
Or
try.
as young as us.
Yes, I'm not as young as you already though. Anyway, optimum blood pressure is the top one less than 120. All right, and the lower part of the blood pressure less than 100, less than 80, 120 and 280. Of course, this number is just the average of a 60 kilo man. For female, they have a lower range. So everyone blood pressure is different according to the size. But as a general rule, when you see a number less than 120, less than 80, no need to worry. All right. Now, people that are at risk. At risk means you need to do something to prevent. Okay, prevent hypertension. It's for those that when you see your numbers, it's already 130 to 139. These are the one at risk. Why? Because this is the best time you can intervene it. You can change your health, change your lifestyle, become healthy lifestyle, so that your blood pressure, potentially can back to normal. So later, Nick and I will talk more on how to prevent hypertension, what diet to eat, how to exercise to make your blood pressure better. Yep.
They always ask me this question as a pharmacist. Which one is more important? You have to pick which one is more important. The top number more important or the bottom number more important? This is the question that they ask the pharmacist.
True. Because some patients, they want to know everything because they are very concerned of their health, which is good. But sometimes we do not want to confuse people. So for the lower part one, okay, as a doctor, I just share, what doctor interpret. When your lower part persistently more than 90 and 100 means your blood pressure has been high for quite a long time. But from our treatment part as a doctor, we will always follow the guidance of the upper value of the numbers. Okay, when you measure your blood pressure machine, later we will talk more on how to measure blood pressure using the machine. Okay, so this is the value of the numbers. You have the systolic and the diastolic. So you just look at the top number. Okay, and also hypertension, there is a lot of stage. Okay, like what we say as a severity, mild hypertension, moderate hypertension, the severity, the seriousness. Now let's look at this beautiful chart again. So for stage 1 hypertension, which is the mild hypertension, okay, you can look at the top one. The systolic blood pressure is 140 to 159. Okay. Now for the stage 2 hypertension, which is the moderate hypertension, is the systolic 160 to 179. All right. And for the stage 3 hypertension is the systolic more than 180. And for the isolated systolic hypertension, okay, this one is not about the severity of blood pressure or hypertension. This one is a type of blood pressure that only involve the top numbers. Okay, this one is not so high. Okay, so some people, when you notice, especially elderly, age more than 70, more than 80, okay, their upper value is more than 140, but the lower value is not as high. So it's called as isolated, means single only, isolated systolic hypertension. So now different hypertension will need different type of medication. So there are medication that is specifically tailored for people with, hypertension that having high systolic and diastolic, and there are special medication that are tailored for people that having isolated systolic hypertension. So don't panic. All you need to do is monitor your blood pressure at home, chart it down, and bring to see your pharmacy or your doctor nearby. All right?
I think talking about all of this, monitoring and also the medication that are individualized, I think it's very important for all of you to understand that everyone needs a different, you will need a different medication. Everyone will have their own different medication based on the doctor's judgment. So it's not something like, oh, my friend is eating that, I want to eat that, right? This is something that happens to a lot of patients that, that comes to the pharmacy and talk to us. Oh, my father is eating that. This medication should be quite suitable for me because my father is eating that, or my friend is eating that. The doctor recommended him, so this must be a good medication because it's recommended by a specialist. But it really doesn't work that way. So it's something that we have to be very clear, to all of you here. So talking about measuring and also how to measure. So maybe a doctor can just explain to us on how to measure your blood pressure.
All right.
The right way.
Very accurate example. Like for instance, in my clinic, I will have a patient. He's father to 3 children, and then he's saying that he has this high blood pressure, but he has been taking his wife medication, like what you said, they're sharing medication together because they try to save costs, but it is not safe to do so, because some blood pressure medication, it is safe for people with kidney problem. Some are specially tailored for diabetic problem with hypertension. Now, let me demonstrate to you how to measure your blood pressure today. Because we all know doctor has been asking everyone, measure your blood pressure, measure your blood pressure. But I believe that not everyone is familiar the basic rules of measuring blood pressure. Number one, get yourself a good equipment. Get yourself a, good quality blood pressure machine. Because even though I know, sometimes you can buy online, the cheap one, like 30 ringgit you can get one, but sometimes they are less accurate.
So it's very important to ask your doctor or to ask your pharmacist, and don't just ask Dr. Google. When you press in, right, blood pressure monitor, you have everything from, let's say, the 30 ringgit up until something that is very pricey. So what is suitable for you, you really need to check with your doctor or your pharmacist.
Because sometimes when you get a blood pressure machine, they are not so accurate. So they will give you readings that, may cause false alarm, or they will give you false assurance, and then you won't really know your health status. And if you want to get a really good quality blood pressure machine, it's not very expensive actually. If you think of your measuring every day, whole family can use. Your father can use, your mother can use, your auntie can use, your grandmother can use. When you divide by the days, it's actually very worth it. Right. So let's start off by measuring the blood pressure.
I'll be your model today.
Yeah, because I believe that buying a blood pressure machine is also basic knowledge or an art. You need to select, because of course I'm not a salesman selling blood pressure machine, but different blood pressure, they come with different advantages. Like some they will only come with the battery ones, some they come with an electric plug. So I advise, if budget is not a concern, invest in a good blood pressure machine. If let's say you can buy one that you can charge together, because some of my patients will tell me, oh doctor, I no battery at home, so I can't be measuring my blood pressure. So don't give us an excuse. So you just find a proper blood pressure machine, and some blood pressure they come with the recordings of the previous record, which is very good. You can see the records, alright, and it's very easy to use blood pressure machine. You just need to know how to press it, okay? So how to measure blood pressure? Number one, get yourself the right equipment, and also the right brand. Okay, you can research around the famous blood pressure brand and invest in it. It's worth. And also get yourself the right cup size, okay? Because sometimes they come with different cup size. Some is a small cup size, some is an M cup size. You can see here. Okay.
You have a range.
Yes, you have a range.
And not every brand that has it, but some of the brands they will let you know either in the box, it's not printed on the box, or even printed on the cup. So it will let you know what is the range that is actually on board. You can see here, right? 24 to 40 cm. So ensure my arm is not more than 40 cm. So yeah.
So if let's say your family, you have a father is way, so you can buy a different size, and buy at home, because this size is removable, so actually whole family can use it. So just this cup into the blood pressure machine, and then the most important thing that you have to find the arrow of the blood pressure cuff. Okay, this is where the blood vessel flow. So you need to place this on the top of your eyes, right? So you can measure your left side, right side. Okay. Can you just rest your hand on the paper?
Okay.
Yep. Okay. So when you want to measure your this, upward the cuff, you have to be downward, not on this, You have to follow the direction of the pressure. Yeah. You just put it in. Okay. Just remember this one on top of the eyes, because when you want to measure, try not to put your hand like this. Instead, keep your palms open, palms facing on the ceiling, right? And then put this cuff in, and then this one have to be at the lower part, okay? Lower part here. And then because some of them, when they measure wrongly, then they will give you accurate result.
And a few things to add on. Of course, you should have about like 1 to 2 cm over here. There's some space right at the bottom here. Okay. And it does not be tight. So at least you can just squeeze in 2 of your fingers. So if it's okay.
Very good. Such a knowledgeable pharmacy. Alright, so of course you have to make sure that your cuff size can actually, wrap your whole arm instead of some if they're too small, they wrap halfway only. So it won't give you accurate result, alright? So you should wrap your whole arm, and then you should always make sure your cuff is at the level of your heart. So when you want to measure, okay, don't just back from office and then rush, sit down and quickly measure. Your blood pressure sure will become high because you are rushing, you have adrenalines and all. So rest, sit down for 5 minutes, take a rest first so that you'll get an accurate result. So when you want to measure, the cuff have to be same level as your heart, okay? And then you have to sit down with your feet flat on the floor, alright? Uncross your leg. Don't cross your leg and measure. This will affect the result. So of course we want the accurate result. If not, suddenly you see abnormal numbers, then you have to eat medication whole life, then you'll feel very sad already, right? Alright. So once you get all done, and then always remember 30 minutes before measuring your blood pressure, no exercise, no food, no coffee. It's not a restriction though. It's to give you a more accurate result. Okay? And no smoking, 30 minutes before, no smoking, no coffee, no alcohol, no exercise. Then you measure before food. That will give you an accurate result, because all this, it will cause your blood pressure to be high a bit. So because that doesn't mean that one number of high blood pressure reading means you have hypertension. You need a few readings. Then you just press on the button here, press on it. Then it will run and pump. Then later it will give you the result. Then you chart it down. All right? Yes.
Talking about things that make you panic, right?
Yes.
There's also an occurrence that is called white coat hypertension.
Yes,
when they
yes.
go and see the doctor, they
Yes.
get panicked, which result in a higher blood pressure than your normal reading. Dr. Wendy is also wearing white today.
White coat.
Yes.
Yeah.
So this is something that we need to keep in mind. So that's why a lot of them, they will ask, why when I go to the doctor, the reading is like this, but when I do it at home, it's another reading, right?
Yes. Very good question to share actually. So I have a lot of patients, when they see a doctor, their blood pressure will be high. Okay, some when they come to the hospital suddenly one day, the very common story is, let me just share with you all a real life story. I have a patient, she worked in the corporate world. She just had a meeting in the corporate office and she didn't hit her KPI. So she very stressed in the car, she very stressed in the car. So she come to the hospital, then the blood pressure goes sky high. When she come to the hospital, blood pressure goes sky high, then they all thought that he has a high blood pressure. Then they rest him well, ask him to calm down, then the blood pressure will slowly go down. So sometimes this is what we call as stress-induced hypertension. All right. So stress-induced hypertension, for this group of people, we do not want to unnecessarily, give too high dose of the blood pressure medication. So one of the methods for people that tend to have a bit anxiety or stress, stress-induced. So when you measure the blood pressure, you have to rest, at least rest 5 to 10 minutes, rest properly. So when you measure, you don't keep looking at the blood pressure. Basically, when you keep looking at it, people like this, right, the blood pressure will go even higher. You have to rest, and then you don't have to frequently monitor.
One tip that I always tell them,
Yeah.
a lot of patients, they will come to the pharmacy and check.
Yeah.
What I tell them is, relax, think of the blue sea, think of a very nice island, and then you measure. That's one tips that I share with them. And talking about anxiety, actually, I don't have anxiety, but there was one time during my college years,
Yes.
I cannot really finish all of the topics that I need to cover before the exam.
Okay.
I had some sort of an anxiety attack. That's when that I feel I feel something wrong. I went to see a doctor, and the pressure is much elevated. It's about 140 plus. So the doctor said the same thing. Oh, it's because of the exam, the anxiety. So doctor just asked me to relax. Maybe you can come back for another check. Maybe when the exam is finished. So don't have to be too worried. But there's a lot of things that can actually affect your blood pressure.
Yes.
And another question that they asked me, just now I checked it's 116. Why now I check it's 112? The blood pressure actually it goes like a wave, so it's not going to fix at one level. That is one thing that they always ask me. Is a machine faulty? So now I check 116, now I check 112. There's something wrong with your device. That's something that they always tell me.
Because I notice people that live in the city and people that live in the suburban are different. Because people when they live in the city, they have their job is more challenging, they have more stress, and they're also more efficient. So when they see at one number, they'll get alerted already. So ideally, sometimes doctor will give you a booklet. You can measure any booklet, measure your blood pressure in any book. All right. So what is hypertension is when you measure, right? You measure once. Okay, if let's say you wake up around 8 o'clock in the morning, all right, you can measure 8 a.m., 8 p.m. Plus minus 1 or 2 hours is okay. So when you measure around 8 o'clock, after you measure once, you rest for 5 minutes and you measure again. Get 2 reading is more accurate. So usually when you bring this book to a doctor, after you measure for 1 week, right, the doctor won't see one number and terus start you on medication. So sometimes when you measure your blood pressure, let's say it's 120, the top one, 110. Occasionally after you watch football, you get excited. So blood pressure suddenly jump up to 150. Then don't worry, relax, okay? You just sit down, relax for 5 minutes and measure again. If it comes down slowly, it's okay. Don't panic. So the idea is, you keep monitor for few reading and then bring this booklet to your doctor. All right?
So talking about the book just now, it has the AM and PM, right?
Yes.
So another question that we always get from patients, what is the best time to measure their blood pressure?
All right, very good question. Now, the best time to measure the blood pressure, okay, the concept is like that. We doctors, we want to know what is your blood pressure before your medication and after your medication. And ideally, it's because you have a blood pressure in the morning and at night. Because sometimes, some people, they will have high blood pressure happen, especially at night, called nocturnal hypertension. All right, that's why some doctors, they will ask the patient to take medication at night, some to take in the morning. So ideally, if can, you just give us morning and night. But if you're too busy working, you're rushing, you can actually measure in your office also. And ideally, we want the blood pressure before medication and after medication. If can, you try to measure your blood pressure before food, if it's possible. Yeah.
Talking about food, right?
Yep.
Another questions that people always ask,
Yes.
what food is good for my blood pressure? But of course, it doesn't mean that you can stop your medication after you take this kind of food that is good for your blood pressure. But theoretically, what are the foods that would help?
Very good question. When I have patient walk into my clinic, when they have high blood pressure, I need to start them on medication. They will say, no, doctor, I want to try natural method first. I want to try natural method. I want to exercise, eat healthily. All right. Sometimes if your blood pressure is a bit high, at risk, just borderline, not very, very serious, yes, you still can try healthy lifestyle, eat healthily. But when your blood pressure is too high already, anytime you can have risk of, when your blood pressure is so high, sometimes there's risk of bleeding in the brain, and this is very dangerous, it's life-threatening. So we do not want patient to risk that. All right, so for those patients, they have to take medication and also eat healthily. So of course, there are a lot of food that actually can help to reduce blood pressure, but bear in mind, food can only reduce, a very little extent. But of course, eating healthily is always better than, not eating at all. We cannot just depend on the pill and, we don't do anything good for our health. We just eat all the junk food, eat high salt food. It's not right also. We need both. To have a healthy life, you need medication. If, you're sick enough, you need medication. And also you need to, eat healthily, stay healthily to further improve your health. Some people, when they come, they're so sick. Instead of, initially you try to aim for not sick. But once you are no longer sick really, you try to be, healthy, healthier, fit and strong. So that's the idea about it. That's the basic about it. So now, what food to eat? All right, so number one, oats. Oats is a very good food. You know, oats can reduce your cholesterol, can reduce your blood pressure also. Okay, and also reduce your, because when you reduce your cholesterol, because cholesterol, blood pressure, sugar, these are all interrelated, you know. If you bring down the number one of it, it will also help to complement the other. So eating oats in the morning is good for your blood pressure, and also taking yogurts. Low fat yogurt, all right? The serving is around 1 to 3 cups per day. They also, you know, help to reduce your blood pressure and also provide you calcium in the body. Now, the other one is you can actually take lots of vegetables, all right? So, of course, the health guideline will recommend to have a healthy diet, you need plenty of vegetable. Now, the concept is, okay, look at this palm. Imagine this plate is about healthy diet plate. Half of it, you need plenty of vegetable and plenty of fruits. 1/4 is carbs, 1/4 is protein. Quarter, quarter, half. Simple as that.
Or in Malay, we call it suku separuh.
Yes,
Yes.
suku separuh.
So separuh should be your fiber.
Yes.
1 suku or 1/4, it will be your carbohydrate. But even then, I think carbohydrate, we will recommend those that is low glycemic index. Those like those that's brown rice, means that it will affect your sugar in a less manner.
Yeah.
I think so. Not all carbs are equal, but that's a topic separately. But I think one more thing that doctor mentioned that is pretty good just now is about salt.
Yes.
I think doctor mentioned about salt.
Yes.
So salt is one of the main source of problems when it comes to hypertension.
Yeah.
So if you want to change your diet in a beneficial manner for your hypertension issues, then cut down the salt is something that you should really practice.
Very good, answer to that. And how much salt to take is, remember, 1 day less than 1 teaspoon of salt per day in your whole diet. Because some of the patients, their blood pressure is due to, high salt in the body. So some of them, if they reduce their salt intake, they will improve their blood pressure in a big way. This is called salt sensitivity, salt-sensitive hypertension. All right. And also talking about the vegetables that you can take, broccoli, spinach is very good. And also there's a lot of, superfood like a sunflower seed, or the seed, which is quite good. It will help with the digestion and also bring down your blood pressure. And also olive oil is also very good. It will help to reduce your blood pressure, and it is also a good source for good cholesterol, because this good cholesterol will bring down your bad cholesterol and then bring it away from your arteries of the heart. Okay, so in another way, it will help to bring down your blood pressure as well. And also what you say is correct. If your diet consists of, lower sugar content, like a low glycemic food, so carbohydrate, we have, complex carbohydrate and simple one. Complex carbohydrate, they have a lot of high fibers. They stay in the stomach longer, so they will give you more nutrition, like rice. And also when you cut down on the carbohydrate, it will also help to bring down the blood pressure and also improve your cholesterol. All these metabolic problem, sugar, cholesterol, blood pressure, they are all interrelated. You bring it down one, it will help to complement the other.
Okay. When it comes to, when patients, the first thing they ask is, I don't want to take medication.
Yes.
Can I adjust it with my diet or with food? Yes. Second thing they will ask about herbal medicine. I don't want to take medication. Would herbal medicine works? So what's your opinion?
Very good question. Okay. Disclaimer, I'm not a traditional doctor, my expertise is Western medicine. But if we follow the Western medicine, the guideline of the health, there's no research and not enough data to show that traditional medication reduce your blood pressure. So when we doctors, we start people on medication based on the blood pressure. All these we follow guideline. So how guideline, come from? Guideline come from research data, from all the previous records that shows that patient with this blood pressure, they need to be on medication. If not, the risk of the complication of hypertension is high. And what medication helps you is all also based on the research they have done on the medication. All right, so all this is scientific proven. So when you follow a treatment that is scientific proven, okay, that support with a lot of database research, so it's very safe. And all this already had their side effect written from the from the guideline, from the guidance. So when you start something, at least doctor know what to do. So what we are worried of, if you start something that is not really reliable source, so when you have all the side effect, like you have your problem with the kidney because of certain medication that is actually not approved by 𝐾𝐾M, then it will bring a lot of problem, and by the time it is too late already to do anything.
And talking about medications,
Yeah.
right? It's all about the risk and benefit.
Yes.
I think too much focus is on the risk,
Yeah,
right? When they take a medicine, they always ask doctors or pharmacists, if I take this medicine, right,
Yes.
what side effects there are?
Yes.
But they don't really ask, if I don't take this medicine,
Very good question.
5 years or
Very
10 years down the road,
Yeah.
what would happen to me?
Yes.
Right? So we are looking at a risk that could be very low, maybe 1% or even lower than that, depends on the medication.
Yeah.
But if you don't take your medication, as an example, blood pressure, you might have a high risk of stroke down the road. Depends on your age, depends on your body size, your body weight. It can up to 10% or 20%.
Yeah.
So it's really about risk and benefit when it comes to medications. So I hope that for everyone out there, when you ask your doctors or your pharmacists about your side effects, which is good actually, it's you need to know about your medicines, but also at the same time ask about your doctor, what the medication do for me. So at least you can evaluate both the risk and benefit.
Talking about this, let me just share a real life example, from the past. So there's a patient who is a father for 3 children. All right, so he always has high blood pressure, but he always, in denial, he say he want to a healthy lifestyle. But in reality, it's very hard because he work as a lorry driver. He have to drive odd hour, and how to eat healthily when you often work outside. So we also understand that it's not easy to eat. Ask someone to use diet control and all. So he let his blood pressure continue to get high, but one day, after 2 years, he come back to us. And during that time, he start to develop kidney failure because he do not want to take medication to control the blood pressure. So that's why if you have long-standing hypertension, it will damage our kidney. Because the pressure is so high, it damage our kidney. So it come with end-stage kidney failure. Okay, initially last time he complained to me, oh doctor, very expensive, medication very expensive. But now, because he had this kidney problem, he need to be on a dialysis. Bear in mind, once you develop hypertension, and also once you develop complication of hypertension, and especially end-stage kidney disease, cuci buah pinggan, dialysis, 1 month 3,000 ringgit lifelong. Now what doctor is telling you is to control your blood pressure, you only need to take the medication once a day. Sometimes if you're really forgetful, you take at night also never mind, morning also never mind, because some medication, they cover 24 hours. Talk to your doctors. Get your treatment tailored to your lifestyle. Sometimes it's not about, once I be on this medication, I will be forever dependent on it. It's that we detect something early. Sometimes when you have blood pressure high, it's because of genetic, it's because of lifestyle. All right, let me just share another real life story. Sometimes, when patients, they hear the real story, because sometimes we've seen, too many cases. So that's why it's not that I want to scare the patient,
But it's good for them to have an example so that they at least they
know
can
the
visualize.
seriousness of it. Okay, let me just fix my hair for a while so that the mic can capture my voice properly. All right, so I have a friend who is a doctor. He has high blood pressure. He has high blood pressure on the on-call day during work. Okay, weekend no high blood pressure. So he's very stressed working, but he do not want to take medication for the blood pressure. So after 4 years, my friend who is a doctor, he have heart failure. All right. So that is why he had heart failure, and then imagine that sometimes when you have stress-induced hypertension and all, you have stress-induced hypertension, do not neglect that. Yeah. So
that's why sometimes when it comes to medications, right, you really need to pay attention, of the timing. Even though, of course, the doctor mentioned that if you cannot take in the morning, sometimes at night, it depends on the doctor's advice.
Yes.
But to have the best effect, sometimes it is not sometimes, it's always good to stick to the same timing. That will be the best way. But if of course your lifestyle doesn't allow it, then you can discuss with your doctor, to have a plan that is individualized for you. Yeah. So before we move on to Q&A, we have quite a lot of questions pouring in. One last question, doctor.
Yeah.
Talking about, still a lot of patients would say they really mati don't want to take medicine. Okay, we talk about, diet, we talk about supplements. Now, they will say, I go to gym every day. I attend yoga class at 2 o'clock. I attend some, cardio exercise session at maybe 4 o'clock. I do that every day. So would that help? Or do I still need to take medicine?
Very good question. Now, we doctors, right, we do not force treatment on patient. We always give the best, treatment based on the guideline, based on the risk, and also we give your option. If let's say you're strongly refuse, because we do not want you to run away from us forever. So if let's say you see yourself having, mild hypertension or at risk, you can give yourself try healthy lifestyle when your blood pressure is not too high. Too high must take medication. Okay. So when you see your blood pressure is at risk, okay, give yourself a time frame. After 2 months, see back the doctor with your blood pressure after 1 month. Don't like after 6 months only see, you won't have the motivation. And healthy lifestyle is not easy. Because you have been on this lifestyle forever already, and then suddenly within 2 months you need to change your whole lifestyle. But of course, I believe if you want to do it, you can. Now, exercise. How much exercise to do? According to guideline, 30 minutes of moderate intensity and intensity exercise per day. 30 minutes per day, 150 minutes per week. Okay? Moderate intensity is not like, walking to the office. Is jogging, or swimming, or bicycle, And also, of course, other than doing this aerobic exercise, you can also add on some dynamic resistant exercise like weightlifting, to strengthen your peripheral muscle, your core muscle. Yeah. So of course you can do some yoga also will help. Yoga, meditation, it will help to, relax your mind and also lower your blood pressure to a small degree along with medication if your blood pressure is high enough that require to take medication.
I think it's both important to take your medication if your doctor advises you to, but never to ignore the lifestyle modification part. So before we move to your Q&A, I know all of you have been waiting. It's pouring in now. So before we move on, it's time for the giveaway session. So listen properly. It's now the giveaway session. The question is, what is the normal blood pressure reading? Okay. A, 150/80. B, 140/90. C, 90/60. D, 125/80. What is the normal blood pressure reading? Let me repeat once more. A is 150/80. B is 140/90. C is 90/60. D is 125/80. Okay, I hope you get my question now because that's the giveaway session. Good luck and hope you get the prize. Okay, now we shall dive into the questions from the audience. From K.E. Tun. Hi, Dr. Wendy. What is the age that human is more vulnerable to hypertension?
Very good question. All right. So of course, most of the time, the common age group of us develop hypertension, and as it is the age where we are aging, because what happens is as we age, the artery wall get calcified. So when the arterial wall get calcified, and also, human, we tend to develop bad habits of smoking, alcohol when we go into teenage and adulthood, So this is time we will cause hypertension, usually at the age around 40, 50, 60, but some patients, they have family history, they have underlying kidney problem. So they might have blood pressure high, hypertension at young age. But don't worry, even if you have high blood pressure or hypertension at the age of 30 or 40 or even younger or 16, don't lose hope. You just get the numbers within your control, within the normal range. You can also always live a normal life, like a normal adult without any complication or kidney problem. If let's say a patient with high blood pressure, that doesn't mean it is the end of the world. If he get his number correct with the help of medication, he can live like a normal without the complication of kidney problem, eye problem. All right, like for example, I'm a doctor. I also got asthma. I also on medication every day, inhaler, But because I take my inhaler, I take my medication, no choice. Because, sometimes this is genetic. Doesn't mean that, oh, how come this happened to me? Don't victimize yourself.
Yeah, I think, but it's, of course, we have an age around a certain age that you're more vulnerable to hypertension. But if you are young, don't just assume that you are healthy. I think a lot, for those that are around our age, they always say, I'm still young, I don't need to get a proper health check. Why do I need to go and see a doctor every year for proper health check? I'm just about 20, I'm about 30-ish, so it should be fine. So that is not something for you to assume, right? So make sure, even though you are young, go and get a proper health check.
Yep.
So the next question from Ara Deva Haran. Good evening, Dr. Wendy. Does medication for hypertension has side effects? Right, the same question that we talked about just now. Side effects, long-term side effects.
Very good question. Don't worry. All right, everything it comes with pros and cons, But then to think of the severity of the side effect of the medication until you're so scared to take, you have to think of what if your blood pressure go high? The brain can bleed, cause bleeding in the brain, cause death. The kidney can get damaged, and then you can go into end-stage renal failure. It's not that I want to scare you. Of course, there is side effect of the medication, but it is very low risk and it doesn't happen to a lot of people. There are a lot of type of hypertension medication, such as one scientific name is called amlodipine. That one won't cause any problem to kidney, won't cause any problem to your sugar. That one is very safe. But for some medication like ACE inhibitor or ARB group, now, this group of medication, they have extra benefit. They can protect your kidney and they can protect your heart. But some people, their body, they are more susceptible to get a bit of creatinine high, but it's very, very rare. And also, doctor, when they start you on this medication, they will know how to measure you. All right, they will always give you a plan. They will see you back in 2 weeks' time to measure your kidney. So it's very, very safe. Don't worry. All right, it's not like we start something and then suddenly you develop. When we start a medication, doctor will always tell you what is the common side effect. If it happens, don't worry. If let's say you have a side effect of the medication, even the creatinine go up high, you just stop it. It will recover. It's not like take the medication and then you will have kidney problem and spoil already. No. It's not like that. You have side effect, but we will know how to monitor according to guideline. Okay, and also we will know what is the benefit. All right, so don't be too worried of the side effect, but think of the complication of hypertension that is more common to have complication of hypertension rather than having a serious side effect of the medication.
Talking about creatinine, the doctor mentioned just now, creatinine clearance, of course, is a measurement of your kidney functions. So the next question would be, again, a very common question from Josephine Yu. Is it possible for us to recover from hypertension?
Very good question. Okay, sometimes we do not want to give false hope. A lot of us, when we have hypertension, it is a long-standing, is it because our arteriole has calcified or maybe we have underlying problem like kidney problem causing that. So for this group of patients, once they already reach to the stage of they require medication to help, they will be on lifelong medication, but it is okay. Sometimes our body, when we have this, this sickness, we need medication to help to have a good long quality life. But I do have a small percentage of patients, especially those that working in professional, like lawyer, accountant, they're very stressed, facing all the numbers. So sometimes they need medication to help, because they're constantly stressed. But once we see that they're retired already and they have time to go exercise, eat healthily, their blood pressure will improve a bit. So this type of patients, sometimes we need to off their medication and observe. And some patients, when they have hypertension, because they are obese, all right, or overweight, and also they have diabetic, but once they improve their sugar level, and also once they lose weight, we can see that there's improvement of the blood pressure. But it all depends on the severity. So if you detect your hypertension early or blood pressure abnormalities early, at the early stage, mild stage is possible, But when your blood pressure is already very high, long-standing, it's okay to be on medication to prevent you from getting the complication.
Talking about arterial hardening is just a professional term for just the hardening of the blood vessels. So especially for those that's aging, especially those that has age, that's quite old, the arteries will so harden. Unlike the youngsters, right? The younger population, the artery is like a balloon, right?
Yes.
You pump and then it will just absorb the pressure. It's very elastic. But this is not the case for those elderly people. So that is why a lot of elderly people, they are more vulnerable and they will need their medications more. Also, I want to correct something is that they always say, when I start my medication, I cannot stop. It is not that the medication make you addicted to it, but it's just that when you are on the medication, right, as you age, it is only getting more and more likely that your arteries or your blood vessels will harden up. So it is likely that as you age, you will need your medications more. It's not that the medications make you addicted. I think that is something that we have to, I think for audience out there, I think a lot of friends would tell you, once you start the medication, you cannot stop.
Yes.
But the reason behind it is not that it makes you addicted. So maybe we will go through one last question. Okay, I think this is a very good question as well from Selena Liu. Is there a situation whereby a person blood pressure is extremely low? Because just now, according to the chart, right, we were talking about, as long as your blood pressure is below 120 for systolic, below 80 for diastolic is normal, right? So they're asking about, is there a low blood pressure to one extent that is too low?
Very good question. Unfortunately, there is no single number, to say that what is abnormal, but as a general rules, all right? Okay, for women, our arm is, smaller. So we can't take that your blood pressure have to be 120. No, all right? So if let's say you see your blood pressure is less than 100 or less than 90, but you're feeling all right, most of the time it is okay. Unless if you are feeling unwell or you having dizziness, or fainting episode, then you need to measure your blood pressure. If your blood pressure is less than 100 or less than 90, you must see a doctor so that the doctor can make sure that there is no other problem that causing the low blood pressure. But it really depends. I give an example. If let's say I have a patient, she's very thin and small size, only around 39 kilo, but for her blood pressure is always like 95 over 60. So the doctors have done all the tests and already make sure that she's safe. So for this group of patients, we have other methods of interpreting, like taking the systole minus the diastole, as long as the average of the systole minus the diastole, it is more than 25 or 30, it is quite safe. But of course, this is very complicated to you all. When you're not sure, you see your numbers, the top one less than 100, okay, see a doctor. Less than 90, you should even more see a doctor to just get confirmation. So don't panic, or see a pharmacy. All right, just get help from any healthcare staff.
Okay, let me just one more question since we still have a few minutes. Okay, this is from Elaine Poon. If I am already on medication now, taking daily around lunchtime, okay?
Yes.
This is a very common question as well. What if my blood pressure before medication is already at optimum level, say it's 110 over 70? Can I skip the dose for that day? I think that's a very common
good
question.
Okay, number one, please, don't be so kanchiong, want to faster off your medication, all right? So how the medication work? All right, certain medication, their onset, their duration will last for 12 hours, all right? Then the effect will go off. So sometimes, why certain medication need to take twice a day? So some medication, they need to take once a day. So when your blood pressure is already optimum, means that it could mean that sometimes your blood pressure, the medication is just nice to control your blood pressure. That's why your blood pressure is nice all the time. Because the certain blood pressure medication, when you take once a day, it works 24 hourly, So that is why your blood pressure is optimum. Now, at what stage do we need to, might thinking of consider of the medication? Very rarely, we shouldn't have the concept of try to think when to off. We should just think how to stay healthy, keep your numbers right. Unless when you're experiencing fainting episode, you feel like faint or very sleepy or always faint all the time, then you need to see a doctor to check. there could be other reasons that cause the fainting episode, or whether it's the medication, a bit too strong for you, then the doctor will adjust the dose. So don't be too hurried of, I need to off the medication. No, sometimes when we already have the risk factor and the family gene and the calcified artery, medication is there to help us, to reduce the risk, and it relax our arterial smooth muscle of the blood vessel. Yeah.
Okay. So yeah, sometimes a lot of patients are too rushed. They're always thinking about when can I stop the medication? When can I stop the medication? When can I stop the medication? At the end of the day, I think the takeaway today it is lifestyle and also your medication can go together.
Yes.
Right? It doesn't mean that you're on medication, you can skip your lifestyle.
Yes.
It doesn't mean that you adjust your lifestyle,
yes.
especially if you have very high blood pressure, that you can skip your medication.
Yes.
Okay, that's the first concept that Dr. Wendy has relayed to us. The second one would be, of course, the risk and benefit. Don't just thinking about the side effects, but I think that what Dr. Wendy mentioned about keeping your body in a good condition.
Yes.
So that is the most important one.
Yes.
So before we end, I think there's something that I missed. For you all to win the prize, remember to like CARiNG Pharmacist Facebook, like and share this live stream, tag 3 friends or family together with your answer in the comment section to increase your chance of winning. Okay, so not only you need to get the right answer, but also like and share. Yeah. So before we end, maybe Dr. Wendy can just give us a wrap up. What takeaway message that the patients or the audience today should know.
All right.
About hypertension.
Always remember, there is no single pill that can fix all the problem. Everything requires effort. Ultimately, when you reach to the stage that your body requires medication to help, you need to take your medication. And also, you cannot just depend on medication and just, forget your healthy lifestyle. You also need to have a healthy lifestyle. It is not difficult. When you go to a restaurant, just tell them, okay, less salt. Vegetable, less salt. Less sugar, all these little things will actually help in a big way. Okay, so healthy lifestyle, exercise 30 minutes a day, 150 minutes a week. All right, salt, less than 1 teaspoon of salt per day. I know it's not easy, but when you really train on how to appreciate the natural taste of the food, then you will appreciate it. Then it's easy for you to do. And also, you can do some exercise like aerobic exercise, like cardio exercise, and also learn some, leg lifting, weightlifting. Sorry, I'm post-call anyway. Weightlifting, resistance exercise. I think that's about it. Yeah, and also avoid smoking, and also avoid alcohol. Keep your alcohol to minimum limit as possible. For male, less than 2 units or less than that per day. For female, 1 unit or less. But the best is no alcohol at all. It will help the blood pressure in a big way. And also keep a healthy weight. It's very important. Keep a healthy weight. When you bring down your sugar, you bring down your weight, your blood pressure will cantik. Then you can think of how to, slowly improve your health in a big way. Don't keep thinking on how to stop the medication. It is not the solution.
So when you go to mama, always tell them kopi ais or teh ais kurang manis. Look into their eyes.
Yes.
Betul-betul kurang manis ah. Betul-betul kurang manis ah.
Or teh kosong. I know the taste is not good
Okay, so thank you, Dr. Wendy, for this entertaining session.
No problem.
I hope all of you learned a lot about hypertension and how to beat hypertension, not only by using medication, but also by using lifestyle modification and also by practicing a healthy lifestyle. Yeah. So thank you, everyone, and I hope to see you again. Bye.
All right, take care.